most recently. This evening we will have Dr. Charlie McCaslin. As you're logging on, please let us know where you're logging on from.
So we also know that it's been sort of a wild week. If you guys, when you're logging on, first obviously tell us where you're logging on from, because we'd love to see where we're reaching, but we would also love to know any of your favorite resources that you found to be helpful this week. So a lot of us are home with our kids. We're kind of doing this whole mom school, dad school, work at home, weird thing, whatever your routine is now. And there's been a lot of Facebook Lives and educational things that are being shared. And maybe if you share them in the comments, someone will say, oh, I'd never seen that one before. That's kind of interesting.
It's so cool because we've been going back and forth. My son is 5, whether we should do public school, private, homeschool, and there's so many resources now. It's really great.
We've been homeschoolers for a couple of years, and it's really inspired. So we usually have to hunt for these resources. And the cool thing is that they're just everywhere now.
Everywhere now, I know.
And it's really cool. It's
stress reducing, so many cool resources. As a reminder, this show is brought to you by the Shwachman-Diamond Syndrome Foundation, providing support for patients and their families around the world. This show is also public, so please don't write any private questions. We'll upload these shows to the SDSF website and YouTube. We are adding subtitles for you to translate into your home language.
Tonight, as you're asking questions, some of you have submitted them to the Facebook page, and so we've taken those. Nicole and I asked a couple months ago for pulmonology questions, so we tried to incorporate those in. And then obviously we are going to be talking a lot about the coronavirus and how it is affecting the lungs. But tonight, as you're typing in questions, please try to keep them fairly general. Dr. McCaslin will not be able to answer very specific questions. Save those for your own doctors or hematologists or primary care physicians. We have a lot to get through tonight. But first, we wanted to share our giveaway because it's a very good one tonight. You guys are all going to want it and fight over it. Nicole and I were talking about what you guys need right now, and we came to the conclusion that you guys are in need of
toilet paper. The hottest commodity in the nation right now. I installed a bidet personally. I figured this out 3 weeks ago. I'm not going to fight y'all in the crafts. There's no shame in my game.
I'm sticking to toilet paper because my kids and I really like to use the toilet paper rolls for crafts. So we fought for toilet paper and we were successful. That's why we have one to give away to you guys, because we know how much you all probably need toilet paper. It's a very crazy world right now, and it's like a commodity.
It's a hot commodity.
It's more important than gold.
We're going to start our show kind of general with how SDS, how the lungs and SDS intersect, and then we're going to get a little more specific about the coronavirus and the lungs.
For those of you who don't know us personally, I have a clinically diagnosed SDS child with neutropenia, lung, and kidney issues, as well as some skin issues, some cognitive delay issues. Nicole has a genetically diagnosed SDS child with neutropenia and elevated liver enzymes. So we both come from very different backgrounds, even in the SDS world. And Orva, who's the wizard behind the scenes, she has a clinical SDS child with SDS and a cystic fibrosis mutation. So we all come from different views on this, and I think it's always really beneficial to see the other side of it, at least for us.
Well, it's interesting creating the shows around that because we each have a different perspective to create the show. And then as far as the coronavirus, I mean, they're saying don't take ibuprofen, and then the Tylenol may affect the liver and then the lungs and neutropenia with the pneumonia. So this is a hot topic. In the SDS world, obviously, because we have multi-organs being affected, or could be affected, I should say.
Absolutely. So with that, I think we would like to welcome Dr. McCaslin onto the show. I will let him share about where his background and his background is and where he comes from and who he is.
Hi, am I live?
You are definitely live.
Perfect. There we go. The screen just changed. I'm Charlie McCaslin. I'm a pediatric pulmonologist. I now live in Jacksonville, Florida, and I work with Nemours Children's Healthcare System there. And before that, I was in Grand Rapids, Michigan, which is a wonderful place to live and work, right? And I did all of my training in Indianapolis, Indiana at Riley Children's Hospital and Indiana University. So
You've
I've
been
been
all
taking
over the
care
map.
of, right. I've been taking care of kiddos with different lung problems for nine-ish years now.
So appreciate you being on our show. Actually, I don't know the answer to this next question, and I'm curious for my own son. Are lung airway issues present from the beginning, or is it something that can develop over time with SDS patients?
It actually can be both. It's not terribly common for kids with SDS to have lung issues, but certainly some do. The congenital ones, the ones you're born with, tend to be related to dystrophies or changes in the rib cage shape and how the ribs move that can cause a baby to have trouble breathing or trouble coughing and clearing their lungs. Then as kids get older, most of the damage happens from recurring pneumonias and infections in the lung due to neutropenia. And over time, the lung tissue gets kind of scarred and loses the ability to clear mucus, and it sort of compounds over time, infection leading to damage, leading to infection, leading to damage. And then, of course, sometimes we just have two random things that happen together. And a lot of kids have asthma and Shwachman-Diamond together, but are totally unrelated.
We fall into that generally weird category all the time.
How common is bronchoscopy and other airway abnormalities in SDS patients?
So bronchus suis, also we
Oh,
call
Swiss.
it.
I said that wrong.
Okay.
Sorry.
We call it pig bronchus because it looks like the anatomy of a pig. Is pretty uncommon. You can find statistics that say about 0.1% to 2% of the general population of people. I don't know of any specific association with kiddos who have SDS and having a pig bronchus. And basically what it means, your lungs, when they divide, split into right and left, and then the branches off the right and the branches off the left. But in a pig bronchus, the right upper lobe starts to branch off from the main trachea before you get down to where they split. So for most kids, it is totally just found by accident or incident, and they don't have any trouble. It's just something unique about them. Occasionally, though, it can cause trouble clearing secretions out of that lobe of the lung, and then retained secretions and mucus turn into infection on occasion, or sometimes can be associated with narrowing, making kids maybe cough or wheeze more, but generally not associated specifically with SDS.
It's always so hard to know what's with SDS and what's not because it's already a mixed bag of tricks. And so
Right.
to try and sort needles in haystacks is hard sometimes.
I would guess that a lot of kids with SDS end up getting bronchoscopies because they have a cough from infections and things like that, and then we see it. And so maybe we report it more in kids with SDS because they probably get more bronchoscopies than the general population.
That makes sense. So jumping to the subject of the coronavirus, in general, a viral season which lung patients already have struggles with, what can we do to minimize the viral infections or upper respiratory infections year round, not just when there's a pandemic?
Yeah, that's probably the most important thing we can talk about now. And we'll probably talk about this more later, but we don't really have a lot to offer for treatments for most viral infections, including coronavirus. So the number one thing is to try to prevent it. It's something that we all could do better at, and some people are better than others. So specifically the number one thing is hand washing. You know, hands, we touch other surfaces, we touch our face, our mouth, our eyes, and we transmit that virus. So making sure that you wash your hands pretty religiously, but especially anytime you're going to eat, anytime you're cooking food for you or for your child, anytime you need to touch your face, if you're going to put your contacts in, you know, that's a very easy way to put a virus in your body. So hand washing, number one. It's always best if you can to keep your distance from sick people. So we don't normally quarantine like we're doing now in home, but even if you're out and about and you see someone who's coughing and sneezing and hacking, maybe go the other way. Try to keep your distance the best you can. For you to maybe help from spreading it to other people, when you're sick, stay home if you can. You know, try to avoid going out. When you cough into your elbow. Try to keep it off of your hands. I think the practice of handshaking is probably one we're going to have to get rid of during the winter months, but certainly right now with coronavirus, and you can just give a wave or an elbow bump instead. And then cleaning, surfaces that are high touch surfaces like doorknobs and cabinet pulls, countertops, things like that. Trying to use a good cleaner with bleach or some kind of disinfectant will help minimize the risk that you're going to touch something that someone else has touched or coughed on and spread a virus to.
There we go. I think we're all back now. Sorry.
Can you hear me?
No worries. I hear you now.
We're here now.
Yeah. Live is important, but it comes with technical difficulties sometimes. Okay.
It is.
So,
We learned to roll with them pretty well, though.
Erica asked, is it true that nebulizing is very risky? Dr. McCaslin?
Can you hear me? I don't know if anyone can hear us now. Sorry, guys. Thanks for being patient with us through this. We're trying to figure out, there just seems to be some snags tonight. Can you hear us, Dr. McCaslin?
I can hear you.
Oh, there we go. Okay. So someone had asked if is it true that using a nebulizer is riskier and we should stick to inhalers?
So there are some reports, nothing that's been proven in a study, but there are some reports that the nebulizer can be risky in two ways. It could aerosolize the virus into these droplets, and that's what we're trying to avoid. So it could spread viral infections to those around you. So if you're giving your child a nebulizer, they could more easily spread that virus to you or other people in the room. And there are some other thoughts that maybe using the nebulizer drives the virus lower into the lungs and maybe causes more severe infection. That certainly hasn't been proven, but I think it is a good precaution as far as trying to control an infection from spreading around, especially in a hospital setting, to try to use inhalers as much as possible in place of nebulizers.
That's a really good question, Erica. Joan asked, are pulmonary function tests a good beginning if you think a child might have lung issues? So this is going back to a general SDS lung issue question.
So Joan had asked, are pulmonary function tests a good beginning if you think a child might have a lung issue? This is, again, back to being a general SDS question.
So pulmonary function testing, number one, requires a fair bit of patient effort. So we start trying to get pulmonary function test on kids around age 5. Most of them aren't able to do the maneuvers repeated over time so that we know we're getting good measurements until they're 6 or 7 years of age. So for younger kids, we can't do them. There is such a thing as infant pulmonary function tests, but those are a lot more complicated and not many centers do them. Certainly is a good measure to find out what's going in the lungs if a child is having symptoms of shortness of breath, recurrent cough, things like that, but may not be the only thing. Sometimes, a good history, an exam, a chest x-ray, or even a chest CT might be what you need instead of a pulmonary function.
For children who are on inhalers and nebulizers, what do you recommend to be the washing schedule for their appliances, I guess you'd call them?
In general, we say once a week, hot soapy water and let it dry. Some people will use a bleach solution or a vinegar solution, and that depends on what you're specifically washing and whether or not that equipment is safe for that. But in general, once a week is fine. Especially, this is not talking about a piece of equipment shared among people. This is one piece of equipment for one kid or one adult.
Definitely. We had one last question come in real quick. She said, hi, this is Anouk from Holland. I'm assuming like Holland, the not the city in Michigan. I have a daughter with SDS. She's 5, and I'm wondering if corona is dangerous for SDS patients.
Yeah, well, I think coronavirus is dangerous for all of us. The general reports, what we're seeing is that children are doing better than adults, and it's more the older adult population who's at the highest risk from the most severe infection. But anybody with underlying lung disease, especially including a child with underlying lung disease from SDS, would be at higher risk.
Okay, and then let's see where we were at. So, oh, this is a good one. Someone read online that if you sip water very frequently, you can help avoid the virus from getting into the lungs, as sipping water would send any virus in the mouth into the stomach, where it would be killed by stomach acid. Is there any validity to this claim?
No, I wish it were true, but I think that's a myth. Though being well hydrated is always a good idea. The problem with trying to sip water to clear out a virus is any mucous membrane on your body could get infected with a virus and pass it in. So you could be inhaling it through your nose. You could even get it in your eye if someone were to cough and a piece of spit hit you in the eye, or you touched a surface and touched your eye. So we can't, as easily rinse our noses and our eyeballs and everything else. So unfortunately, I don't think that would work.
That would be nice if it did, though.
Is the RSV shot worth it? Can the toddler get a shot, and how do we get it covered?
The question was, is the RSV shot worth it? And can toddlers get the shot? And if so, how would we get it covered?
So that's usually the issue with the RSV shot. That's called Synagis, and that's a collection of antibodies against the RSV virus. So it's not a vaccine. A typical vaccine is part of a virus or part of a bacteria that they inject into the body and teaches the body's immune system to fight it off. This is just what we call passive immunity, so antibodies from other people against RSV. So the only thing it's useful for is clearing RSV. It doesn't actually teach the body how to fight RSV, and it doesn't work for any other infections, including coronavirus. So there are certain really specific indications for who would benefit from an RSV shot. Most commonly, that's newborn premature babies who were born before 29 weeks, especially, but also maybe if they were born later and have additional heart or lung issues. It's really pretty hard to get it covered after that first year of life. Very few children meet those indications, and those are a little bit different state to state and even sometimes insurance to insurance.
That's pretty typical for insurance. So we've had a couple of questions come in, and I don't want them to get buried. If your child has known lung disease, should we be asking from our physicians to have backup oxygen during this pandemic?
I generally don't give backup oxygen to kids who aren't on it already. So kids who have backup oxygen at home are usually kids with tracheostomy tubes and or ventilators, or kids who need oxygen at baseline. If you are sick enough to need oxygen with coronavirus, you need to be in the hospital. And the reason is you could get much quicker very fast. What we're seeing sometimes with the coronavirus infections is kids and adults really kind of turn a corner quickly and get pretty severely sick. And we certainly don't want that to happen at home. We want that to happen, if it happens at all, in a medical center where you can get the attention that you need.
Absolutely. Someone had asked, what could be some of the causes of lowering pulmonary function tests without known problems with lungs?
Well, a lot of times I get children referred to me, not talking about kids with SDS, but children in general, for abnormal lung functions, and they may be low or they may be declining over time. And a lot of times it's the technique, and going to a pulmonologist with a respiratory therapist who's used to testing children, we can usually figure out what's going on. Sometimes it's technique, sometimes it's the machine or the reference sets. And then sometimes they're just underlying lung issues that don't produce typical symptoms like cough or wheeze. Sometimes kids just have shortness of breath, and it even can progress so slowly it may not be so visible when you see your child every day.
Definitely. So Joan had asked, and I think she was replying to something we had said earlier, so it enters through the mucous membrane and not the skin. And I think she was talking about how the cough in the eye, and all I imagined was a baseball bat.
No baseball bats. Yeah, it definitely doesn't go through the skin. So if you were to touch, if someone coughed on the table and you touched the table, you wouldn't get it through your hands. But if you didn't wash your hands and you touched a mucous membrane, like your mouth, nose, or eyes, then it can go through into the cells pretty quickly.
Which is why I'm always trying to be most aware of where my hands are and what my hands are touching, because I'm constantly shifting my glasses up. And even though I'm not poking my finger directly in my eye, it's now leaving it on here, and they don't really know how long it's living on surfaces. And I just saw something come out that it lives on shoes for 5 days.
Yeah, there are some reports that like plastic and other surfaces, it can live for 3 or more days. So
I did read wearing eyewear actually is helpful instead of contacts. Wear glasses, I guess, to protect the eyes. But I don't know if that's true. Don't believe everything you read online.
Well, I will tell you, in the type of isolation that we use for something spread by droplet like coronavirus, you do wear goggles or a face shield. Now, contacts wouldn't provide any protection, but we want to try to keep any, even if you can't see it, but any particles of spit or fluids from flying into your eyes. You definitely should benefit from wearing glasses or goggles.
That would make sense, because it's like I'm not directly going underneath my glasses, but it's some type of protection from it.
Right.
Someone had asked, should we go to a hospital right away because SDS is an underlying health issue once symptoms begin, or should we still wait at home and continue to monitor? It's a really good question.
Really good question.
This is a really good question, and this is a question that actually has a different answer right now during this pandemic than it might have at other times. So in general, even in children with SDS, I would hesitate to go to the healthcare facility at the first sign of symptoms. Most children tolerate this virus really well at home. It's a cold that's kind of flu-like, fevers, chills, muscle aches, but then they recover fine. And we certainly don't want to expose them to other people or expose other people to them on the way to the hospital or in the hospital. And resources are going to be critically thin in our hospital system. It's actually best, in most cases, to try to wait it out. So reasons you would go in for healthcare is you have a really significant shortness of breath. Your child can't speak in full sentences, or you look at them and they're just huffing and puffing to breathe, even when they're just sitting still. Having fevers that you can't control with things like Tylenol or Motrin, not eating or drinking so much that they don't make a lot of urine. So maybe they normally pee 2 or 3 times a day, but they're only peed once that day. Or when they cry, you don't see any tears. And then if they're just sleepy and they're not acting like themselves, you can't wake them up. Those are reasons that I would definitely go right away. Otherwise, what I would recommend is to call your primary care doctor. Talk about your symptoms over the phone and say, my child best in the healthcare field. Should I go? Should I wait it out?
Yeah, there's a lot of telehealth going on right now. I think you're still muted, Nicole. There's a lot of telehealth visits going on because it's obviously very backwards for us as SDS patients to not go when we first see a sign of fever or a sign of symptoms, because of the first sign of fever, we go in. This is not to be said that if you meet your fever protocol, you should still be contacting your hematologist, aside from any lung issues, because as always, we're worried about bacterial infections lying underneath things. And if your kid's anything like mine, he likes to just sneak it right in there and not really pay attention to any sort of rules. But trust your gut, call your physician. The one who knows your child on a daily basis or monthly basis, and knows their baseline, their real baseline, not this.
I would say when we were building the show, saying we normally go, when we hit fever protocol, but this is a situation where I would be really, really nervous to go in, and I definitely would want to talk it out with our hematologist first. We got a question: why do some kids not have low O2 with pneumonia?
It really depends on how severe the pneumonia. So pneumonia is an infection in the lung tissue, so in those little alveolar air sacs. And luckily, we're sort of built and engineered in a way that we have more than enough. But at some point, you reach a threshold where so many of them are infected that the rest of them can't keep up. So it depends on how widespread that pneumonia is, and also if there are underlying lung issues. So if the lungs are totally healthy to start with, or if they're already damaged by something.
Do you think neutropenic patients are more affected with corona than others?
I think neutropenic patients are just a different category of risk. And like Michelle just said, that those are certainly kids that you probably don't want to just wait it out. You definitely should call right away and talk to your hematologist. And maybe it's not a bad idea to call now and say, what's my plan in this corona pandemic when my child has a fever? Do we wait 6 hours? Do we come right away and get some specific advice? So Neutropenia, lack of neutrophils, generally isn't any difference in risk for viral infections. You know, the neutrophils are not typically a big part of fighting off a viral infection, though some part of it. So that alone can make them potentially get sicker. But then also secondary bacterial infections are much more likely to set in. And so that's when I typically counsel people about respiratory illnesses. You know, a virus typically lasts 7 to 10 days. If you're not getting better by then something's wrong and you need to go be seen. Now, what we're seeing with coronavirus is that might be even a little bit longer. So this might last, instead of 7 to 10 days, it might be 10 to 14 days. But you know your child, and if you're seeing, you know, you're at day 10 and symptoms are worsening instead of getting better, definitely make that call and say, hey, I got a concern.
So one of the things the CDC, now I don't know if the CDC recommended this or some governor somewhere, but at some point along the way, there was someone that said that asthma patients should self-isolate for 12 weeks. Do you think that's beneficial? Do you think that's overkill?
I think with this virus, with this pandemic, we should all be somewhat self-isolated. That's a really long period of time. And to be honest, we don't know how long this is going to last. We don't know when it's going to peak even. So, you know, my general rule of thumb is we should all be sort of quarantined at home to the best of our abilities. We should all be doing hand washing, avoiding sick contacts, all those things that we talked about earlier. And the more severe underlying illness you have, including asthma, you might need to take additional precautions.
I've seen a few people ask variations of questions about this and some articles going around, and I don't know how to read articles with big words and understand them fully. So someone had asked, can you explain the cytokine storm and how immune compromised patients may be affected by this virus? There's discussion and theories that may fare better because they do not elicit the same way.
Gotcha. Well, in general, cytokines are chemicals in the body. They're signals that different cells use to talk to each other inside the body. And when we get any kind of infection, it's usually our immune system that makes us feel like junk. So when we have fevers, when we have aches, when we have all this mucus, that's our body trying to get rid of the infection. And cytokines is part of that, sending those signals. What specifically we're seeing with sort of cytokine storm is some people later in this course of coronavirus are developing a cytokine storm. So all these chemicals get released all of a sudden, and they develop something called ARDS, acute respiratory distress syndrome. So this is what I was kind of mentioning earlier, when people can take a fairly quick turn for the worse. And so you have all these cytokines going crazy in your body, and in the lungs specifically, that makes the blood vessels, the capillaries, leaky. Fluid leaks out of them into your lungs, and when your lungs fill up with fluid, they can't do their job. So they can go from just needing a little bit of oxygen to needing a lot of oxygen to needing pressure to get that oxygen in the lungs to even needing a ventilator to do that job for them. So all that fluid is a reaction to the cytokine storming. Now, if you don't have a normal, typical immune system, there are thoughts that maybe you won't have as much cytokine storming, depending on what type of immune cells are missing or what type of immune signals are missing. But that's a really complicated thing, and I'm not sure just, you know, neutropenia, for example, from SDS would really make a difference in cytokine storming or not. It certainly could. There's certainly reason that they wouldn't make as many of those inflammatory chemicals, but it's a really complex system with lots of different white blood cells and not just neutrophils.
Super interesting. We'll have to, unfortunately, a lot more people will have to be affected to see how that plays out, but super interesting. What does clearing the virus mean? What is that?
So clearing the virus really just means you got rid of it. You fought the infection off and you're better now. So like I said, those fevers, those chills, and that mucus is all trying to get rid of the virus, get it out of your body. The cells are trying to gobble it up or secrete chemicals to kill them. And then eventually, when we recover from an illness, we've cleared the virus.
So everyone that gets the illness will clear the virus, or can it linger in your body for a certain period of time?
There are a few immune deficiency states, or maybe somebody going through a bone marrow transplant or chemotherapy who could not clear the virus. It could linger on for a long period of time, but the vast majority of people will clear it and get rid of it. So the tricky part about that is, and what a lot of people are asking me is, if I'm sick even if I don't know if I have corona or if I do have corona, how do I know when it's safe to go outside again? How do I know when it's safe to be around people again? So the CDC has offered some guidance on their website, and I'm going to look at my cheat sheet and make sure I don't tell you wrong, because as we learn more about coronavirus, things are changing. So if you're at home and you're sick with coronavirus and you've been isolating yourself, they're generally saying, it's the CDC, it's generally saying it's okay, it's safe to go out of the house when you're 72 hours from your last fever without taking any medicine to prevent it, and you've had improvement in your respiratory symptoms, so your cough, your shortness of breath is better, and it's been at least 7 days since you first got sick. Now, if you are less than 7 days and you need to go back to work or things like that, the second protocol is you could be swabbed and tested for coronavirus, and you have to have 2 negative tests 24 hours apart, along with the fever resolving and the lack of or improvement in respiratory symptoms. But that just means you have a lower risk of sharing the virus, of spreading the virus. It doesn't mean it's a zero risk. And there have been studies looking at viral shedding, meaning transmitting the virus through saliva or even stool or urine, or different studies, and they've seen viral shedding for many weeks after this, like a month after. And so even when you've met those requirements and you're safe to go out of the house, it's still not safe to do things like, I wouldn't go visit someone who is immune suppressed. I wouldn't go visit someone who's elderly. I wouldn't go back to work in the healthcare field right away until you're sure. Maybe you've had that swab twice, because the last thing we want to do is spread that virus, even though we're feeling better. They've even found some children in the study they released from China, they found about 4% of kids who tested positive for the virus who had no symptoms at all. So you can be sick with the virus and spread it before you even feel bad, or maybe even don't feel bad. And then you can still spread it after you've had it as well.
Great.
All those children touch everything with their hands. I had to go to the store earlier, and I've avoided it for a while, and all I could see was just like the eye level of where kids would touch, and I'm like, I can't touch any of that. Like, you all just touch things.
I've never thought about that kind of stuff so much, and touching my face too. Like every time I touch my face now, I'm like, oh, don't touch your face.
Don't touch your face. Don't touch your face. I like when I'm telling people, I'm like, don't touch your face. And I'm like, oh, I'm touching my face all the time. With the nebulizer question, someone had asked me, this was sent to me personally, so sorry, it's winging it, but along with not recommending nebulizers, at the same time, they also didn't recommend albuterol. And I know you and I had talked about this a little bit, but I didn't know if anything's changed in the last couple days regarding it.
No, there hasn't been anything published or seen as far as risk of like albuterol making things worse or any change with the virus. And certainly some people with asthma, for instance, would be really at risk if they didn't use their albuterol. So I think, my advice is still the same. We should try to use inhalers if that medicine is available in the inhaler. And if you need the nebulizer because you don't have the inhaler, or the inhaler doesn't work for you, or the medicine you need is not in an inhaled form, you got to do what you got to do. You got to take your nebulizer if that's your only choice.
There's some speculation that the virus has been around longer than it started in China. There's been a lot of talk about that, about people saying, I had all the symptoms 2 months ago. Oh, I'm sorry, before it apparently was in our areas. How do you feel about that?
I think it's probably not likely that coronavirus has been in our area. I think, unfortunately, this is happening in viral seasons. So we're seeing RSV and other ones like human metapneumovirus, influenza, rhinovirus, lots of different viruses. The reason the coronavirus has been discovered, has stood out, is because it spreads so quickly. It's more contagious than the flu, for example, and it's more severe than the flu. So they noted in China, probably in November, December, that, wow, there's this really severe respiratory illness going around. And I think that honestly is when and where it started. I don't think it started elsewhere and moved around, but certainly has spread very quickly since then.
Do you think that when, I know there's some publications about them working on a vaccine or wanting to work on a vaccine, when a vaccine does come out, do you think it will be available to everyone similar to the H1N1 vaccine a few years back, or will it be more like that, the Synergist shot, where it's just recommended for, like the high risk population?
No, I think this will be like a flu shot and it'll be available for everyone. And I know they're trying to fast track to make this happen. Now, unlike the flu shot, when the H1N1 came around, we already had a flu vaccine sort of template. This is how you make a flu vaccine. This is what works. We don't have a coronavirus template. For most people, and for all the coronavirus infections that we've had in the past, it's just been a common cold, and there's been no real reason to develop a vaccine. So certainly starting brand new from scratch, but I do know they've reported they should have vaccines ready for trials within the next few months. Now, trials will take a while to do, but I do think it's reasonable that it could be within the next year that we could have a vaccine available.
Do you think this novel coronavirus, this COVID-19, is acting in any way similar to any other coronavirus strain? Nathan's had a coronavirus strain. I think it was what landed us our first hospital admission, if I think back correctly, along with a couple other things. But is it acting anything like it, or is it mimicking it?
It is. I mean, it's the same family of viruses, but it's definitely something has changed about it. I'm not even sure they've described what exactly sort of biochemical structural changes they have that has made it much more contagious and much more severe. So it is similar, but worse.
Will viral suppression from COVID-19 be similar to a typical flu-like virus?
Well, symptoms will be typical to a typical, how many times can I say that? Symptoms of coronavirus will be like flu. So their fever is the most common, cough, shortness of breath, and then you have the others like body aches and shortness of breath and that kind of stuff. So certainly the symptoms are similar, and that's another reason it's hard to get a grasp on how fast it's spreading and who really has it and who doesn't. Is because we're still in the middle of viral season, so we have lots of other viruses that make you feel like garbage. We have very limited tests, so in many places, you can't even get tested for corona unless you're sick enough to be admitted to the hospital. Now that's changing rapidly, and we're getting more and more tests. And the other part about testing is some places it's 2 to 4 to 5 days before you get those results. So it's hard to imagine who you may have encountered still in those 5 days waiting, and then you find out, oh, I was positive. So one of the major setbacks dealing with this is that we can't even identify who has it and who doesn't, because we don't have enough tests to test everybody.
It's been really interesting following the different doctors in different areas of who's testing for co-infection. Like if you test positive for flu, they're not going to
Right.
COVID. That not every hospital is doing that, but it's been interesting to see what different areas are doing.
Not every hospital is doing it, and generally we learn in medicine, if you find one problem, then most likely you don't have another one. So don't spend the money, don't waste the time looking for other things. But we're certainly seeing in studies of coronavirus, kids having co-infections with things like flu and RSV. And so the answer is we got to test everybody when we get those capabilities.
Exactly.
I know Michigan's testing for the flu first, and then they're testing for the coronavirus, and there's no opposite on that. There's no budge. There's no leeway.
Right.
I know
And
Texas
that's just
Children's is doing a bundle. They're testing it for it all together, which I thought was good. After recovery, what's the possibility of reinfection?
Well, unfortunately, viruses change over time. So if you get coronavirus, COVID-19, you clear the virus and you recover, the next time it comes around, imagine it sort of circling the globe. The next time it comes around in viral season, you might get it again. It might be a milder illness, or you could be immune. We really don't know how the body will respond to coronavirus, COVID-19. So hopefully, like, flu and other viruses, once you've had it, you develop antibodies. And so the next time it's a much milder illness. But we don't know that's the case for certain yet.
I think you already answered this next question, but I'll ask it again just to make sure. Joan asked, if you still have a cough after the fever ends, can you still pass the virus on to someone else?
Yeah, I think you can. We don't really know how long it takes to completely clear it, but it's looking like weeks long. So you can be completely well symptom-wise and not know it and potentially spread the virus. But you're certainly most contagious. You're spreading the most viral particles when you're symptomatic. So when you're having fever and cough, there's much more virus in your body. So you can imagine there's much more that you could spread. And then as your symptoms go away, you're getting rid of that virus. And so the numbers of little viral particles in your body are going down and down and down over time. We don't know when that's zero, though.
Michelle, that dinosaur costume you wore at Camp Sunshine is going to come in handy if you ever get some something serious like this. I hope you don't, but I might have to get a dinosaur costume myself to continue being a mom.
I'm not kidding. I've had people send me links of the unicorn grocery shopping. I got that one at least 5 times. I got the dinosaurs multiple times because if you know anything about me, you know my family has a family pack of dinosaur suits that we use quite often. We've taken them to Maine, been to the ocean. They've ridden bikes. They are on my wall as a family portrait. Except for unfortunately, our dinos are out of commission, and those I'm not going to make Amazon workers be essential for dinosaur suits. Maybe if it calms down a little bit, we thought about reordering some, but I would be the first person to wear a dinosaur suit out because if we're on like week 2 of isolation and I need a dinosaur suit.
Yeah.
Like now.
Definitely.
Is there any reason for SDS patients to get tested to see if there's an antibody present to know if they've already had it?
I would say at this point in time, it's still fairly new, and the chances of someone already having had it without knowing. So if you haven't had any cold symptoms in the past, 3 to 6 weeks, then there's really no point in testing because you won't have them. Again, there's a really small percentage of kids who are asymptomatic carriers, and potentially they could have already developed the antibodies, but it's really so new into the course that I wouldn't expect to see them. And early on, when you develop an antibody, it's one specific type, and then later, after the infection's gone, you switch over to a different type of antibody. So it even depends on what antibody you're testing for. And then lastly, I don't think the antibody test exists yet to even have it.
If you've already been on an anti-malarial, would it be less likely to contract the virus if, in fact, that does reduce the time of the virus?
There are ongoing starting clinical trials of different drugs, including some anti-malarial drugs in both treating coronavirus and maybe even preventing or prophylaxing against. None of it has been proven yet. It's all sort of experiential. Doctors in this area tried it and it seemed to work, or people took it and it seemed to help. So no one knows if it really does help or not. But should it actually work and prevent or treat coronavirus and you've been on it, then your chances of having an infection or a more severe infection should be down. But we don't know for certain yet if it works. It's hard to make that second step judgment call if it helps or not.
Definitely. Someone had asked, also, thank you. You're doing phenomenal. We are just like lightning firing questions. And if you need to like take a breath or get some water or whatever.
Yeah, if you need some water, you have some water. Michelle and I drink a lot of water during this.
We do.
So much talking.
So what happens after we shelter in place? Obviously, they're saying now that it could be until July or August. And it changes daily, and this virus people learn more about it every day. And so that's probably a good disclaimer, is that what we're talking about today could absolutely be different tomorrow. So absolutely. Nicole and I will put in the links, the CDC recommendations, the websites, everything we've used here or talked about will be in the comments, so you don't have to feel like you have to rewatch it to hear where we're talking and where to go. Someone asked, what happens after we shelter in place? COVID-19 will still be present. So how do we keep our kids safe?
Yeah, so COVID-19 will still be present. There is no way 100% to prevent COVID-19. And again, a vaccine is likely a year away. So we're not going to shelter in place for a year, I don't think. So what we're doing, shelter in place, is basically we're trying to buy time for our healthcare system to catch up. We have X amount of beds in the hospital. We have a real shortage of equipment, protective equipment, gloves, gowns, masks, goggles to protect people in the healthcare field. And we are sheltering in place because we're trying to slow down the spread of coronavirus so that our healthcare system can provide the support we need. So if people get corona and they get a severe illness, they should go to the hospital. They should be able to receive care. And most of us will be fine. Even if you have severe coronavirus, you have good odds of getting over it if you're in a healthcare setting. What we're trying to prevent and what we're seeing in Italy is that there are so many people who have it at the same time, they can't get the care they would normally get and be fine with it and then go home. So, there may be a hospital with 10 ICU beds and 10 ventilators, but they have 30 people who are sick at the same time. 20 of those people may die just because they can't get the equipment and the hospital space they need. We're just trying to slow it down, install it out, and buy time. And in general, with supportive care that we do currently have, people will be okay for the most part. Now, there are certainly people who can get all of the typical supportive care and still not make it. They could still die, but this is a much smaller proportion of the population. And again, generally, probably the elderly people in our population who seem to be at most risk from this.
Speaking of healthcare workers and protecting them, and obviously, that's what the flattening of the curve is so that we don't spike the hospital system. Someone had asked, do you have any recommendations for healthcare workers in their lack of protection equipment when you have an SDS kid? Would you have any special precautions, recommendations, or even, talk about having them come off of work totally to protect their child?
Yeah, that's really tough. That's a really incredibly tough decision, and probably something that people have to make on a case-to-case basis. Well, let's say your family, you can't not work, you got to go to work, and you got to go home. Then the best thing you can do is wash your hands religiously. I've said that 1,000 times. I probably would be that person who undresses in the garage and throws your clothes in a hot washer and leave your shoes in the garage and your ID badge and anything that's been in the hospital in the garage. Go straight to the shower. Don't talk to anybody. Don't touch anybody. And a good hot soapy shower and washing your clothes in hot water with soap probably will get rid of the virus. The real issue is, what if you pick up the virus? And so certainly use the protective equipment that you have. I know a lot of hospitals are running out, and some people are even making homemade cloth masks and things like that. And so even that is better than nothing. And do your best. And I hope that we see that our production is increased in the country, and we have more masks and we have more equipment, and that we don't have to worry about this for much longer.
I know us as a family, we've gone through, and not only am I sewing masks, but we've also looked through our stash of things that we've had over the years from hospital visits or from other flu seasons, and we've pulled out probably 3 boxes of Surgics we're taking to our local hospital because we are sheltered in place. My husband he's taken off work. We're not going anywhere. We have no need for 150 surgical masks right now. And so I urge all of our families to kind of look and do the same and see what you might have that you don't need right now. I'm not saying you can't ever get it again, but right now, think of who needs it the most and who could benefit from it the most if you're not going out.
Right. And people are being really creative. I've taken in some goggles that are for when I weed eat my grass, and people have found masks from paint shops or different things. We have other offices, dental offices, things like that closed, and they're donating what they have. And so, this is the time when we all have to come together and try to, help each other out.
So cool.
Definitely.
Trisha asked, if school resumes in May, would it be proper to send him for the last 3 weeks? I'm just worried about this and his health issues.
Yeah, so, not knowing exactly what health issues your child has, I would say in general, I don't think schools are going to go back in May, to be honest. I would probably recommend, if they did, if you can do it, keep them out. We need to flatten this curve. We need to spread this out, and I just don't think that May is quite long enough. I don't want to say it sort of in a negative way, but I don't think we can avoid the coronavirus at all. It's here. We're going to have to deal with it, but we want to put it off for as long as we can. And to me, part of that is staying out of school. And I think that my kids, who are somewhere in the background, are going to be homeschooling on computers probably for the rest of this year. I hope not. I hope I'm wrong, but we just don't know yet.
Dr. Fauci has alluded to that this could come in waves or phases or reemerge next. Maybe it dies out in the summer and reemerge. I mentioned that to a couple of people recently, and they were very surprised by that. What is your take on that? Obviously, no one knows, but
no one really knows. But we see that pretty much every year. RSV, we see in RSV season, we see it in the winter and it dies down, and we see very few cases. In fact, we probably stop testing in the summer because we just don't see it as much, and then it comes right back again every year. And so coronavirus, the virus itself is around. It comes around every year, and it goes away a little bit, and then it comes back. Now, will coronavirus 19 or COVID-19 come back every year? I really hope not, but I don't know. And that's certainly, hopefully by next year, we have a vaccine so that we can, decrease the severity of the illness or decrease the risk that you might catch it.
Someone had asked if you've had another strain of coronavirus, could your body have created antibodies that may be helpful in combating this novel strain of it?
A lot of times with viruses, we see some crossover, and you've had one strain of a virus, you have a little bit of immunity to the other. But I have to think coronavirus is very, very common. In fact, it's the common cold. And so I think people have had many, many illnesses from a coronavirus in the past, and clearly people are not showing signs of fighting off this coronavirus. I think it's changed so much that I suspect we don't have much cross immunity, but it hasn't been proven yet.
It's so crazy to think of how viruses work and how all of this works, and how I know there's a lot of fear spread amongst our community right now. And the best thing I've been trying to tell people is that, we're used to isolating. We're used to this with flu season. This is not our first rodeo. We know what we're doing. And so I think these questions have really, at least I've seen multiple comments come in. This is great information. These questions are great. One of them was really, really cool. It was, let me find it. It says, "Thank you, Dr. McCaslin, so much. You have single-handedly helped my anxiety and fear."
Oh, that's fantastic. I'm glad I could do it. And to be honest, I'm kind of having fun. I enjoy it.
Come join us.
We should know that Dr. McCaslin has worked on this almost every day since we asked him to be on, because it changes every single day. All the doctors that we have slated since this virus started to be on have been having to work on the show every day because it changes every single day. So we really appreciate it, Dr. McCaslin. Someone asked, does drying, clothes in the dryer for 20 minutes without washing them, would that kill the virus alone?
That's a good question. Probably so. It probably gets hot enough in a dryer that it would.
I'm guessing they're probably asking for like shoes or something that maybe not be able to be washed or something. Another question. Do you recommend any vitamins or supplements like extra vitamin D or C? I know I'm doing a ton of placebo things right now, just trying to keep us healthy. We're having Dr. Seth Corey on in a couple of weeks, and he's really been advocating for zinc, and a lot of people are saying, oh, it's antidotal, and he's saying a placebo is better than no SIBO at this point, just so you think you're doing something. But what do you say?
Well, mental health is part of it, and if a placebo, relieves anxiety for you, then it's fine. So I don't. It's never been proven. Taking higher doses of vitamin C or vitamin D or any of those things will help you fight off those. Certainly, if you're deficient in vitamins and minerals, your immune system can't do its job normally. So taking over-the-counter supplements, I always say make sure it's a good source. Make sure you check the doses and make sure you're looking at pediatric doses if we're talking about giving it to a child. And there's probably no harm. It may not benefit, but I don't think there's any harm. Speaking of that, we should probably talk about ibuprofen because I know that's out there a lot. And they have seen and made some associations. These are not proven. It's never been randomized where we give half the people ibuprofen and half the people don't. But there's some association with ibuprofen and worsened or more severe coronavirus infection. So knowing that, I would probably try not to take ibuprofen. And if you have fevers, if you have body aches, I would certainly try to take Tylenol if you can. I know there's a lot of liver kids out there who can't, but I think now might be a good time to call your hepatologist, to call your liver doc and say, hey, if I try to avoid ibuprofen, can I take Tylenol at all? Can I take a lower dose? Can I take it less frequently? Let's just have a plan, because it probably makes sense to avoid ibuprofen. Even if it's completely wrong, it's caused no harm. Even if there's no association between ibuprofen and severe disease, if you don't take it right now and just to be safe, I think that makes sense.
Thank you for bringing that up, because a lot of the kids do have elevated liver enzymes where they say to avoid Tylenol.
I think that's one of the crazy things between Nicole and I is that, so she has a genetic child with liver issues. I have a clinical child with kidney issues. So we don't ever take ibuprofen. They're like, don't take ibuprofen. I'm like, that's fine. I don't have that anyways. Right. But to think about it from the other standpoint, where if we were told not to take Tylenol, we'd be like, whoa, wait a second. We don't know what we're doing here.
Right.
And it's so hard because it does change daily, and then it obviously with SDS or with any kid, it changes with every kid and
Right.
even adult, and it's hard.
Well, and when we were talking about the show too, like Michelle's really used to lung issues, and she's very versed in that, and I didn't even know how to say those words that we were asking you. So if my son started presenting with some lung issues, anything might be strange to me. I wouldn't know exactly what was normal or, normal viral issue with that. We should probably wrap up the show. We've had you for 55 minutes. Thank you, Dr. McCaslin. We want to remind everyone.
55 minutes too, not even like an easy 55 minutes. Like
everyone of our giveaway. We are giving away the beloved toilet paper, the hottest commodity in the world at this point.
And I think Dr. McCaslin's earned himself a role as well, maybe two.
I have to send you a roll. You can win the toilet paper by interacting with the show at all. Forward it, host a watch party, comment, whatever. Just interact with the show in any way. It's really exciting to see a lot of people outside the specific SDS community, like friends of SDS people or family members or hopping on, neighbors of SDS families hopping on. So the show is getting a little bigger and more people are interested. Thank you guys so much for being interested in the show. Again, it is going to be uploaded onto the Foundation's website, and it is uploaded on YouTube. Subtitles will be added, and you can translate it to your native language.
And as always, please keep sending us questions if you have them. We've pelted Dr. McCaslin with questions all week long. We're still pelting Dr. Liu with questions from 2 weeks ago. So it might not look like we are replying to you right away, but they're being taken in, they're being sent in emails, and they're being answered because, above all else, I think we can speak for almost every doctor who's on the board of advisory or whatever you want to call the official board of the smart doctors who handle all of this. They're there for you guys. They're there for us. They're here to help us, even if we still joke that Dr. McCaslin is our favorite doctor on our medical team, and he's been unpaid for probably a year and a half.
Another reminder, this virus changes all the time. The data changes all the time. So if you watch the show a month from now, this may be outdated information, but we would appreciate Dr. McCaslin keeping up to date literally by the day to create the show for us. We're going to have Dr. Seth Corey, a hematologist. He's also an SDS researcher on in 2 weeks. We have another show slated, but I'll wait for both of those guests to confirm before we announce that one. Michelle and I are just cranking out shows left and right while we're
we do in isolation. I don't know how to sit still with my hands, so I'm making all the masks. And one note about masks is that it doesn't matter what, if you've got a fabric one coming from me, if you've got a fabric one that you bought on Etsy, if you've got surgical masks that you dug out from your nail polish bin, whatever type of protection you're putting on your face, please understand it is not 100%. Stay away from people who are coughing. Stay self-isolated, stay home, stay safe, social distance. Social distance isn't going to play with your friends at a house. It's staying home. It's being careful. It's being safe, because our governor had said that if the way the virus moves is people. So if we stop the people, we stop it from moving. And so if you have this mask on your face, if you really have to go out in public, you really have to go to the store, you really have to go wherever, avoid touching it, avoid moving it up and down. Don't push the nose piece down 8,000 times like I do, because it doesn't feel right, because you're directly touching all of this mucous membrane.
Good point.
Great point. Absolutely.
Thank you guys so much. I'm going to go back to the Netflix Tiger King documentary that I'm so addicted to. If you guys need to watch it.
Yes, thank you again, Dr. McCaslin, for coming on.
Behind the scenes, and thank you to my wonderful co-host, Michelle.
Thanks for having me, guys.
Yes, anytime. I'm sure we'll have you back.
I'd love to.
Oh, there's Michelle.
Bye, guys.
Bye.